The first thing that I would like to tell you people that you should go to is a counseling psychologist if you are suffering from a lower level of disorder. For example, there is stress related to career, there is stress related to relationships, then you can refer to a counselor or a counseling psychologist, right? They use talk therapy, right, and some behavioral interventions to help you combat the disorders. You should remember one thing: counseling psychologist or counselor cannot prescribe you medication, right? They only work on the talk therapy model. And lastly, the qualifications that you have to see of these people is masters in psychology or counseling psychology. That's the minimum qualification to become a counseling psychologist in India or abroad. Second is your clinical psychologist. Now, clinical psychologist is for severe mental health disorders like depression, like anxiety, like schizophrenia. All these are high level of disorders. Now, clinical psychologists used therapeutic techniques and other interventions to treat you. Again, they cannot give you medications, right? They only work on these therapeutic techniques. They use CBT, REBT, psychoanalysis. So all these kind of interventions and therapy techniques they use. The educational qualification in India that they have is MPhil in clinical psychologist. You can also see RCI. RCI is the registration number that clinical psychologists get in India. So if you are going to a clinical psychologist, please ask them what is their RCI number, because there is a lot of fraud going on today. So please refer to the RCI number that they are getting. And lastly, you can go to a psychiatrist, right? Psychiatrist helps you with these conditions of depression, schizophrenia and other disorders. And the only difference is psychiatrist can give you medications, right? But they cannot give you therapy, right? They can only suggest you medication which will help you reduce your anxiety, depression or any disorder, right? What degree they have? They have MBBS plus MD in psychiatry. So that is their qualification to treat this particular disorder.